hope I'm audible and visible. Can I get a quick thumbs up, all of you? Welcome in this session of Dermatology with me, Dr. Chesta Aggarwal. And today we'll be reading about the MCQs on leprosy. I hope I'm audible and visible to all my dear students. Now let us begin with the today's session. So, yes, I hope I'm audible and visible. So, welcome all of you for this week, that is for the 4th March. We will be discussing a lot of, for the 4th week of the March, we'll be discussing a lot of MCQs, or we have a free test series list which is given on the board. I request all of you to please be live for this. We are also targeting the exam, that is All India Mock Test, that is scheduled on March 27, 9 a.m. The next is we have two type of subscription which is known as Plus and another is Iconic. Plus give you an access to Unacademy. Iconic give you an access to both Unacademy and Prep Ladder. I congratulate to all my toppers who have cleared their FMG exam. We do have a lot of special classes on the app. I request all of you to get yourself enrolled. I do take a lot of special class myself. You need to have a code and that is Chesta10 to get yourself enrolled. Now we have a NEET PG 2022 high yield MCQ batch and a FMG high yield MCQ batch. I request everybody to please be a part. And we have three type of NEET PG subscription. One is Plus, another is Iconic, and the third one is Light, where we will be giving you the access to all the MCQs. So I request each and every one of you to kindly be a part of an academy and try subscribing. Now let's start with the leprosy questions. We have all the easy questions and the tough questions included or clubbed all together. I request each and every one of you to kindly answer this. I'll be explaining you the little bit part in between whatever is required. Starting with the first question, the commonest nerve involved in leprosy is option number 1, ulnar, median, radial or sciatic. The commonest nerve involved in leprosy is ulnar nerve, median nerve, radial nerve, or sciatic nerve. Anyone? Amazing. The correct answer of this question is option number 1. Please remember, ulnar nerve is the most common nerve involved in leprosy. Now, ulnar nerve, why? It is because the peripheral nerve. In leprosy, the causative organism is Mycobacterium leprae. In leprosy, the causative organism is Mycobacterium leprae. Now, this Mycobacterium leprae, it mainly affects the cooler part of the body. The reason being the optimal temperature for its growth is 30 degrees centigrade. The optimal temperature for its growth is 30 degrees centigrade. And please remember the core body temperature is 36 or 37 degrees centigrade. So you need a cooler environment for its growth, and that is why the peripheral tissues are more frequently involved, which includes skin and the peripheral nerves, which are more superficial. So ulnar nerve is more superficial, and that is why it is the commonest nerve getting affected. The next question is, which of the following is the earliest sensation to be lost in a patient of leprosy? Earliest sensation to be lost in a patient of leprosy. The earliest sensation to be lost in the patients of leprosy. Anyone? Amazing. So the answer to this question is cold. Please remember, temperature sensation is more frequently involved compared to that of pain, or it is the first sensation to get lost compared to that of pain. In temperature, cold sensation are lost first, then hot. Now, what is the reason and why you see this sequence? Please remember what happens. In the nerves, we have different fibers which are present in parallel to each other. The fibers which carries the temperature sensation, they are present on the peripheral part. The fibers which carries the temperature sensation, they are present in the peripheral part, followed by pain and all the other sensations of touch. So, in the granulomas, enlarging granulomas of leprosy, which is compressing the nerve from outside to inside, the first sensation which comes, or the fibers which comes in contact, is the temperature one, and that is why they are lost first, or they are compressed first compared to that of the others. So, the sequence remains like the temperature, pain, touch, and so on. Clear, all of you? So, the earliest sensation to be lost in the patients of leprosy would be a cold sensation, followed by hot, and then pain when touched and pressure, etc. Please remember the fibers carried by the posterior column tract, that is the vibration sensation, proprioception, all these, and deep touch. All these fibers are never affected in the patients of leprosy. So you will never see the loss of vibration, proprioception, etc. in a patient of leprosy. Swiss cheese pattern of skin lesions are seen in TT Hansen, BT Hansen, LL Hansen, or BB Hansen. Swiss cheese pattern of skin lesions are seen in. Anyone? Swiss cheese pattern of skin lesions, you will see it in. Very nice. The correct answer is BB Hansen. So leprosy, it's a disease which has different presentations depending upon the immune status of the patient. So if the immunity is good, you will get a localized lesion which is known as TT, the tuberculoid pole, which has only few lesions. But if the immunity is poor, patient will develop a widespread diffuse form which is known as lepromatous leprosy, which is known as widespread diffuse lepromatous leprosy. So two type of leprosy, one is TT and another is LL. Now there are a large number of borderline forms, which is the one which has more common presentation similar to that of TT is known as BT. The one where the features are similar to LL known as BL, and there is a midline which is known as BB. Now in BB you have features of both TT and LL, and it is considered to be a highly unstable form. When you have a lesion, it is single or few in TT. In BT, you start to see the spread of the lesions in the form of small discrete lesions distal to the main plaque. These are known as satellite lesions. For BB, you will have multiple lesions which are punched out. But how they are different from the lepromatous group? They are asymmetrical. They are more towards the one pole. While in BL and LL, you will see symmetrical multiple lesions. So that is how you differentiate. Now, if you look at the BB lesions from side, the lesions will have sloping outer margin and perpendicular inner border, and this appearance is known as inverted saucer shape appearance. When you look it from top, this will give you an appearance of Swiss cheese or punched out appearance. Okay, so Swiss cheese, punched out, or inverted saucer shape appearance. All these are the features. Clear, all of you? I hope this is clear. Amazing. So the correct answer of this question becomes the BB type of Hansen, option number 4. Single erythematous anesthetic patch with satellite lesion on the forearm. What will be the likely diagnosis? We have known that as you move from TT to LL, the disease starts to spread. Initially, you will see a large lesion, then you will see multiple small lesions at a distance from the main plaque, followed by development of what? Followed by development of multiple punched out lesions, which are asymmetrical to start with, but later they become symmetrical. So where do you see these satellite lesions? Erythematous anesthetic patches with satellite lesions on the forearm. What will be the likely diagnosis? Can anybody give me the answer to this question? Anyone? Correct. The answer to this question is option number 2. If you concentrate on the image, look at the image. This is a very well defined plaque. These are few small discrete lesions. Now please remember, this is a large plaque with small satellite lesions in them. A large plaque with small satellite lesions. This is a very characteristic feature of borderline hands. This is a very characteristic feature of borderline hands. Clear? A very characteristic feature of borderline hands. And it is the borderline tuberculoid, not the BB, it is borderline tuberculoid. And that is why we have marked option number 2. Inverted saucer shaped lesions seen in. Inverted saucer shaped lesions found in. Inverted saucer shaped lesions found in. Very well done, all my dear students. So, inverted saucer shaped lesions, they are the features of PB Hansen's, which we have already discussed. So I think everybody is right for this particular question. Now this is a little different question because we have not discussed about this variant. 6-year-old child from Tamil Nadu presents with a solitary anesthetic patch on the face. What can be the probable diagnosis? Pityriasis alba, indeterminate leprosy, Pityriasis versicolor, or Tinea infection. Anyone? 6-year-old child from Tamil Nadu with solitary anesthetic patch, the possible diagnosis would be. The possible diagnosis would be. Amazing, all of you. So, a 6-year-old child from Tamil Nadu presents with a solitary anesthetic patch on the face. The probable diagnosis here would be indeterminate leprosy. Now, why this is not Pityriasis versicolor dental Q? Please remember that in Pityriasis versicolor, you will have lesions mainly on the trunk. The anesthesia, you will never see in the patients of Pityriasis rosea. Instead, you will see fine scales. Patient will give you complaints of itching, and when you examine these scales, you will see the presence of the hyphae and the spores which are present in a classical pattern which is known as spaghetti and meatball. Now, why it is not Pityriasis alba? Pityriasis alba have the lesion on the same side face, but again, loss of sensation. Loss of sensation is not seen. So both these features will give you an idea that you are dealing with a patient of indeterminate leprosy. Both will give you an idea that you are dealing with a patient of indeterminate leprosy. Moving to the next question. The next question is on your screen. Non-nodular diffuse form seen in the relapse fascia leonine, common in Central America. What is the answer? Histoid leprosy is non-nodular diffuse form seen in the relapse fascia leonina or common in Central America. Anybody can tell me the correct answer here. Very nice. The answer is option number 2. Now, histoid leprosy, it is a variant of leprosy which is seen in relapse. It is seen in relapse of leprosy. Relapse can be because of two things. Either patient is a defaulter, he has stopped taking the medicines and there is sudden aggravation of the condition. That is the first case. And the second very important reason is development of resistance to the drugs which we give for leprosy. Now, please remember that in the past, we used to give a single drug. We used to give a monotherapy for taking care of leprosy. But why we have stopped giving a monotherapy and we have started giving the multi-drug therapy in the patients of leprosy? The reason is simple, that because we are developing a lot of resistant cases or relapse cases in the patient of monotherapy with Depsol. And that is why we have started giving a multi-drug therapy which includes rifampicin, clofazimine and Depsol. Now, in both these cases, what happens? Patients suddenly started developing multiple asymptomatic nodular lesions. These nodules can vary from 5 to 15 number or even more. You can see the whole body, the whole face, filled with a lot of nodules or papules. When you do a biopsy, you will see the spindle-shaped cells in these nodules, and there is presence of lot of acid-fast bacilli. These acid-fast bacilli, they are arranged in groups which is known as loci. So please remember, histioid leprosy is it is a nodular form which is seen in the relapse of leprosy. It occurs whenever a patient either stop taking the drug, that has become defaulted, or he has resisted to the drug on which we have kept the patient on. In leprosy, commonly involved nerves are. In leprosy, the commonly involved nerves are. In leprosy, the nerves commonly involved are. Very nice. The answer is high ulnar and low median. Now, why the answer is high ulnar and low median? Because the site of affection of the ulnar nerve is at the elbow, while the site of affection of the median nerve is at the wrist. So, in the course of the ulnar nerve, it is affected at a little higher side compared to that of median, which is affected at little lower side in its course. So, high ulnar and low median is the correct answer. Ridley-Joplin classification of leprosy does not include TT leprosy, BT leprosy, indeterminate Hansens or LL Hansens. Ridley-Joplin classification does not include. Ridley-Joplin classification does not include. Very nice, all of you. I hope this is clear to all my dear students. Now, Ridley-Joplin, they have used four criterias. What they have done, they have used four criterias. One is clinical, second is histopathological, clinical, histopathological, immunological, and clinical, histopathological, immunological, and bacteriological. They have used all these criteria and they have classified the leprosy patient into how many types? Into five types. And what are these five types? These are TT, BT, BB, BL, and LL. Please remember indeterminate Hansen and pure neurotic, they are not the part of Ridley Joplin. Instead, they are the part of Indian classification system. They are the part of the Indian classification system. They are the part of the Indian classification system. Which of the following organ is not involved in a patient of leprosy? Testes, bone, ovaries, skin. Which of the following is not a part of leprosy? Testes, bones, ovaries, or skin. Testes, bones, ovaries, or skin. Which of the following is not a part of leprosy? Amazing. The answer to this question is very simple. It is ovaries. So please write down what are the organs which are not affected. Organs not affected in leprosy. It is important because sometimes you get the question. Starting from the top, it is the central nervous system. Only the peripheral nervous system is involved. The central nervous system is not involved in leprosy patients. This is something which you need to know. Second is the endocrinal glands like thyroid, then lungs. Only the upper respiratory tract is involved. The lower respiratory tract is spared. Then blood vessels and heart, they are not involved. Female reproductive tract, which includes uterus, ovaries, prostate in male, and the genitourinary area like ureter, bladder, or urethra. These areas are not involved, or these organs are not involved in a patient of leprosy. So, among the option, the correct answer is option number 3, that is ovary. Clear? Next, 27-year-old patient was diagnosed to have a borderline leprosy and he was started on multibacillary type of leprosy. What is the answer? Anyone? Anyone can tell me the answer here? A 27-year-old patient was diagnosed to have a borderline leprosy and was started on multibacillary type of MDT. 6 weeks later, he develops pain in the nerves, redness, swelling of the skin. The management of the patient illness should include all of the following except. Now, this is a this year NEET PG question, and we have seen that whenever a patient suffers with a lepra reaction, the one thing which you have to do is always do not stop anti-leprosy drug. Never stop anti-leprosy drugs in the patient of leprosy. This is a very important part. Now, what are lepra reactions? These are the inflammatory response which occurs whenever a patient is started on multi-drug therapy. When you start the patient on MDT, there is sudden killing of the acid-fast bacilli. When the acid-fast bacilli they are killed suddenly, what happens? They cause a lot of inflammatory response. And when this inflammatory response is generated, there is sudden exacerbation of either the existing lesion or they can develop a new crop classified as type 1 and type 2 lepra reaction. Always remember that you will continue giving the MDT. You can add corticosteroid, you can give rest to the limb, or you can give analgesia in these cases. Okay, but always continue to give anti-leprosy drugs. Please tell me the answer. All are true about anti-leprosy drug except. All are true about anti-leprosy drug except. All are true about the anti-leprosy drug except. Very nice. Now, please remember the lepra reaction type 2, all of the following are true except the correct answer is option number 1. Now, for understanding this, you need to know what are the different type of lepra reactions and what are their characteristic features. Now, please remember there are two type of lepra reactions, type 1 and type 2. There are two type of lepra reaction, type 1 and type 2. Type 1 lepra reaction occurs mainly in the borderline leprosy, that is BB, BL, BT. While lepromatous, the lepra reaction type 2 occurs in the lepromatous pole, LL, BL. What type of hypersensitivity is type 1? It is type 4 hypersensitivity reaction, while the type 2 is type 3 hypersensitivity reaction. How will it manifest clinically? The type 1, you will have exacerbation of existing lesion. You will have more nerve damage. Nerve damage is more. Exacerbation of existing lesion, you have more nerve damage. What is the clinical feature? In type 2, you have new crops of lesions. So you have multiple painful subcutaneous nodules, which is known as erythema nodosum leprosum. Nerve damage is not seen, but systemic features are more frequent, like fever, constitutional symptoms of joint pain, involvement of the eyes, arthritis or orchitis, etc. So about type 2 lepra reaction, it is seen in lepromatous pole. Arthus type means type 3 hypersensitivity. And thalidomide is the most effective drug. All three of them is true except for option number 1, because tuberculoid leprosy, you will never see a lepra reaction. Here, which of the following is the drug of choice for type 1 lepra reaction? Drug of choice for type 1 lepra reaction. Drug of choice for type 1 lepra reaction. Drug of choice for type 1 lepra reaction. Anyone? Aspirin, thalidomide, corticosteroids, or penicillin. Aspirin, thalidomide, corticosteroids, or penicillin. Drug of choice for lepra reaction type 1. Drug of choice for lepra reaction type 1. Yes, please remember whether it is type 1 or type 2, drug of choice always remains corticosteroids. Even though thalidomide is the most effective drug for type 2 lepra reaction, still the drug of choice remains corticosteroids because thalidomide has a lot of Side effects. The important one is teratogenicity, and that is why we do not prefer giving that drug. So corticosteroid remains the drug of choice for both type 1 and type 2 lepra reaction. Moving to the second question. Drug of choice for type 1 reaction with severe neuritis. Type 1 reaction with severe neuritis. What is the answer? Drug of choice with type 1 with severe neuritis. What is the answer? Anyone can tell me the answer? What is the correct answer here? The drug of choice with type 1. Very nice. Please remember whether it is a severe form of neuritis associated or a mild form of neuritis, the treatment always remains same, and that is systemic steroid. We will not change this fact. Systemic steroids are always the treatment of choice. Drug of choice for type 2 lepra reaction, again I would say the same thing. It is corticosteroid. For type 1 and type 2 both, nothing will change. The answer remains the same. That is corticosteroids. Clear all of you? I hope this point is clear to all my dear students. With this, we are done with today's session. I thanks to all my dear students. Please subscribe the YouTube channel, that is Let's Crack NEET PG. If you like these classes, please subscribe the YouTube channel Let's Crack NEET PG. Also follow us on our Telegram group. The name is same. If you want to subscribe Unacademy, use my code, that is Chesta10, CHESTA10. Please hit the bell icon to get all the notification. Please give me a thumbs up if you like this class. Please give me a thumbs up if you like this class. And if you want to write anything on the comment, please do write on the comment section. Thank you.